Welcome back to Salam Britain, everyone. I hope you're having a great morning with us so far.
Yeah. In a troubling development, Muslim NHS workers have reported a significant rise in racist abuse since the onset of the far-right riots last week. And the British Islamic Medical Association, BIMA, representing around 7,000 healthcare workers, has highlighted the unprecedented fear and intimidation faced by its members.
Yes, absolutely. Dr Salman Wakar is BIMA's president, and he has shared some distressing accounts of healthcare professionals being targeted, affecting their personal and professional lives. This alarming situation is also being echoed by the British Egyptian Medical Association, which represents approximately 11,000 doctors, dentists and pharmacists.
Yes, the hostile environment has led to increased absenteeism and reduced morale among healthcare workers, impacting, of course, the overall healthcare delivery system. NHS England's Chief Executive, Amanda Pritchard, and the Healthcare Secretary, Wes Streeting, have both condemned these acts of racism, urging for stronger measures to protect NHS staff.
Absolutely, and it's a dialogue that we really need to open up and have everybody watching us engage in with. This is a conversation that needs to be happening on a regular basis now. So to talk more about this and, to talk about this in more detail and more, we are going to be joined by Vice President of BIMA, Dr Sahira Dar. Welcome, Dr Sahira. How are you?
Thank you very much. Assalamu alaikum. Thank you for having me. I'm well, thank you.
Wa alaikum assalam. No, it's our pleasure to have you here. You know, we're very, very interested because we also covered this as a news just earlier in the morning. And it's honestly, it's quite triggering for not just NHS staff, but also the community that are using NHS services on a regular basis, particularly given the fact that majority of our GPs are, belong to ethnic minorities anyway. But, to delve a little bit deeper into exactly what is happening and, the cause of all of this, can you just talk about a little bit about specific incidents of racist abuse that have been reported by the Muslim NHS workers since the far-right riots have begun?
Yeah, no, of course, sure I can. Last week, because we are quite a large organisation of thousands of members, we are part of lots of WhatsApp groups and these sort of informal spaces. And it's a space where people were sharing their experiences quite quickly and, looking for assurances, there's a lot of anxiety. So we were hearing cases of GPs being, needing to close, the surgeries had to close early because of fears that there's a riot nearby and the safety concerns to their staff and the patients accessing the services. There was an incident of a man that entered a GP practice and started shouting, "Kill this Muslim man." Now, we don't know if that was a patient or if that was a random person off the street. There have been many cases of patients giving racial and Islamophobic abuse to healthcare workers in hospitals, in A&E, in GP surgeries. So there's really a feeling of anxiety and concern because as healthcare workers, as doctors and nurses, we want to do the best for our patient, and we don't know who that patient is that comes in the door. We want to treat them with equity and respect and dignity, and therefore you can be open to, there's a vulnerability there. And at the moment, unfortunately, what we're seeing is that people that are racist, that have these feelings, are being emboldened to say these things without fear, and therefore healthcare workers are quite vulnerable to this. So we've had these sort of cases, hearing of colleagues being racially abused and having Islamophobic abuse thrown at them. GP surgeries had to shut early and let staff go home because of concerns for their safety. People were working remotely, so they were working from home. There were concerns about doing home visits, especially when patients are elderly and housebound. GPs do home visits for these patients, but there was concerns of safety for GPs that were doing that, and it was decided that people would do it in pairs. And when you've got limited staff resources, this is going to have an impact. It means that possibly you're doing less home visits, or you're having to really think twice about what home visits you do. So this is having a knock-on effect. The anxiety and concern about safety for healthcare workers is having a knock-on effect on the patient care that we're able to deliver.
Would obviously mean an extra workload for the staff that are working. And again, of course, that would have a knock-on effect on the waiting times and the care that the patients get and receive.
Yeah, Muslim communities are greatly affected by health inequalities already. This has nothing to do with immigration. This is just to do with NHS resources and waiting times being really long. And there's a very dangerous narrative played out by the government and media at times that this is a result of immigration. Now, what is going to and has happened last week, because patients are then scared to go out because we've been told to think twice about going, especially Muslim women that are obviously Muslim, people that look Muslim. So this it reaches out of the Muslim community. This is anyone that is of colour. Ethnic minorities generally are being targeted, are scared to go out their house. So if they need health care, if they need to go and see their doctor, they have to think twice about it. So then it makes us think how many people are not accessing health at the moment out of fear for their safety.
Yeah.
So I think the consequences of this will be seen in the coming few weeks. So the increased workload, yes, working in really stressful situations, in a really stressful environment where you are now worried about going to work. So because of the duty of care that we have, healthcare workers are going to work and really worried and anxious for their own physical safety. So we've had reports of a colleague that was driving to work and turning a corner, a white woman was crossing the road. So she was made to stop, and the white woman started banging on her window, throwing racial and Islamophobic abuse at her, totally unprovoked. So there's that's one incident of many like that are happening. So going to work, people, I mean, we've recently put out a survey to look at these sort of incidents and see how people are feeling. And we know that a high percentage of people are fearful and anxious going to work. And then when they're at work, they're fearful and anxious at work. So you can imagine what kind of a work environment that is.
So Dr. Sahira, so are you talking specifically about NHS workers here when you're talking about this survey that you mentioned?
Yes, I'm talking about Muslim healthcare workers.
Yeah, I mean, obviously, as a whole, generically speaking, if we were just kind of paint it with one big brush, Muslims themselves, Muslims or any ethnic minority in the current climate is not feeling safe or comfortable going into work, including myself and Sakina. You know, just coming here to Islam Channel Studios, I have to think twice, and I have to take a lot of precautions. And I mentioned this earlier in the show, which I would not have taken before, like, you know, get in my car, immediately lock it, try and find a space that's local and closer. And obviously these are things that are going to be quite detrimental to majority of us that are of ethnic minority, particularly if we are visibly Muslim, as you highlighted. But on a positive note, I don't know about the public sector, but I've certainly noticed that in the private sector they have adopted and made a few changes which are quite, you know, what's the word? Quite safe, you know, safeguarding them. So, you know, safeguarding their staff. So, for instance, giving them opportunities to be able to work from home. And I know GPs do you know, deal with patients on video call, and we've seen them working offline, like online, throughout COVID. In addition to that, I've seen an increase in public sector retail stores and various places where the security has increased. Now, what I'm really keen to know is what are the measures that are being perhaps suggested, if not suggested, already been implemented by healthcare institutions and authorities to address this rise in Islamophobia or Islamophobic abuse?
Yeah, unfortunately, there isn't much in terms of safeguarding and safety protocols being put in place for healthcare workers. The nature of the job for many is that they can't work remotely, and that's always a last resort for GPs as well, working remotely, because nothing, you know, to have patient contact and see your patients, you just can't replicate that. And we did do that in COVID, and then we've gone back because we had to.
Yeah.
But for doctors and healthcare workers that work in hospitals, that's really not a choice. And, you know, I think you've mentioned it already, the NHS has a significant proportion of Muslim and ethnic minority staff from in all areas, and there's no choice but to go to work.
Yeah.
And unfortunately, and what we're asking our NHS leaders and managers and employers to do is to, number one, to call it what it is, and it's Islamophobic, racist attacks by far-right extremists that have had repercussions throughout the country where people are intimidated and extremely fearful and anxious, and to address that. So there were some localities trust that did that, and I think language is really important, because when an employer and a manager uses that type of language, you immediately understand that they understand your fears, they know your concerns, and you feel supported. So I think statements like that, coming out to say we condemn this and we're supporting you, is extremely important. And then after that comes in putting the safeguarding and the protocols in place. So last week we found that there wasn't enough of the right language, there wasn't enough of the right language of support. And we did it, BIMA did a campaign, hashtag calling it out, where we were challenging some people on the language that was used. And many did come back and said, you're absolutely right, we're going to change our language from now on, which was really positive to see.
Yeah.
But ideally, we wouldn't need to challenge them in the first place to say, this is what it is, and understand that these are, that just, there's so much fear, and we know this, there's so much fear in our community just now, and to realise that extra support is required, and then to put in wellbeing services that are culturally and faith appropriate, so people have safe spaces to talk about their concerns and their fears. So this is a work in progress. Unfortunately, it's been a bit slow to come about, and I think this is also why it's so important that we have awareness raising and training in Islamophobia, and employers take this up to raise awareness of the impact Islamophobia has, and the staff, everyone that works within NHS should have. And that's the case in every public sector. I think there's a lot of work to be done in that space.
Fine. Do you think there'll be a call for some kind of counselling or therapy for these healthcare workers who are finding it very, very difficult or even traumatic to come into work?
Yeah. After the 7th of October last year, we knew that there was a huge surge of Islamophobic incidents in the NHS. Again, this is probably a survey that we did. And we've already been advocating for appropriate wellbeing services that are culturally and faith sensitive for NHS staff. So there was already a need for that. And I think this has been another really traumatic incident that is going to have a collective impact on the community. And even our children are asking, are we safe?
Yeah.
So, there's what I said earlier about the repercussions of this is going to be felt well after our streets will go quiet, but the repercussions will be felt for a long time after that. So I think all employers, NHS or otherwise, in every sector, need to really be thinking about the well-being of their Muslim staff, because we already have this extra burden of racism and Islamophobia in our workplace and our personal lives. And this is another incident that's going to increase the stress that we're working under.
Yeah.
Absolutely. So do you think that, so I was going to ask, how has this hostile environment really impacted the overall healthcare delivery system, as mentioned by the British Egyptian Medical Association?
Again, like I said earlier, the fact that we are working in such extremely stressful and anxiety-raising circumstances, and patients are not possibly patients are not accessing the healthcare that they need.
Yes.
It will have an impact on the health inequalities that are already faced by Muslim communities. I think we don't really know what that impact is in terms of provision of healthcare. We'll know that in times to come. But GP surgeries, I mean, after that initial having to shut up early and let staff go home, now that the streets are quiet and the riots have gone, GP surgeries are back open. I mean, like I say, it was a last resort, and purely to do with really serious concerns for staff safety and also patient safety. There was an incident of a GP surgery that just had to barricade up and shut up shop with staff all inside, with patients inside, and they had at some point decided that they would keep things locked up but let patients in. But even that's not a workable solution. And these are only temporary solutions, and people were, as soon as the streets were quiet and the riots have finished, business is back to normal, because this is the nature of healthcare workers. There's a strong duty of care and service to our patients. So people are working as they normally would have been, but in increasingly stressful situations with that anxiety of their own of physical safety, going to work and even at work still.
Yeah, and on that note, Dr. Sahira, what I'd like to actually explore is, okay, we know that there is a group of people that could potentially create a riot or come and attack, but at the same time, we know there's a potential that some of the patients themselves that are coming into surgeries or into medical, practices, etc., are far right riot supporters. Now, what precautions are we taking to ensure that when we're booking appointments or calling people into the clinics are being vetted before they come, and they potentially could be allocated the correct GP, just to ensure that there is no, there's no adding fuel to the fire, which is already quite lit?
We treat all our patients equally, and there is no vetting system where we can vet for someone that's going to be racist.
Yeah.
There have always been incidents of patients giving racial abuse or Islamic abuse to GPs. At the moment, those incidents have greatly increased in the last 2 weeks. There's a significant increase of that. And as you mentioned earlier, significant numbers of GPs in our communities are Muslim or of ethnic minority background. Whole practices are often full of staff that are from ethnic minority backgrounds. This safeguarding, the being proactive against this sort of abuse, Islamophobic and racist abuse, has to come from the top down.
Yeah, I
In the
agree.
localities where we see our patients, this is not our responsibility. We have to do the best for our patients, but that rhetoric, that narrative, has to come from the top down, because the reason these are happening is because the races are being emboldened to do this abuse, and there's no fear at the moment.
And
So it very much comes from for example, our health secretary, when he released that statement about that zero tolerance approach and protecting our healthcare workers, that was really welcomed. But we now need to see that translated down to our local communities from the top.
Yeah, absolutely. And that's exactly where I was coming to, actually, because I just wanted to flag up and highlight what NHS's England's Chief Executive and the Health Secretary have said with regards to the protection of NHS staff from racist abuse. And you've just mentioned it in passing, so thank you so much for that.
No, absolutely. Yes.
Right, so Dr. Sahira, it's been a pleasure to have you. Is there anything that you could advise us as we, to take away from this conversation in a way that as patients or even medics that we could be doing to ensure that we are protecting ourselves and just making sure that we're taking the precautions necessary to avoid any kind of confrontations?
I think we all have a responsibility here. First of all, we're Muslims, and part of our deen is to be hopeful. So this is not, I think we need to be very careful that we don't become the victims, and we're hopeful that this will get better. And we come from a position of power, and we have all the resources that we need to do that. I think if people are, as healthcare workers, they can lobby their employers and their trusts to make sure that they have appropriate Islamophobia training and workshops for all staff to raise awareness of the impact of this. And this is a really, really good time to have those conversations, because it's a case of, well, look what's just happened because of the Islamophobic rhetoric that's come out over many, many years. Look at the result of that, the hate that's been on our streets. So what are we going to do that on a local trust level? What are we going to do that in our practice? Let's raise awareness of Islamophobia and educate our communities on that. I think that's my kind of take-home message. Use this as an opportunity to one, we have to be hopeful, and two, raise awareness of the impact of Islamophobia.
Which definitely you have done. Thank you so much, Dr. Sahira.
Thank you so much. And we will carry on with that mission as well and continue being advocates, inshallah.